Experience has been really positive so far. I think primarily because these these frontline workers has been doing yeoman's job to care for people with their expertise and compassion, and it's a literal and figurative shot in the arm. It's almost celebratory when they get it. We have about, all told, with our affiliated staff and our employees, about 35,000. About 17,000 of those are direct frontline workers. We've been able to immunize just over 7,000 thus far in the 2 weeks that we've been immunizing our staff.
Is that what you anticipated, or have you been seeing bottlenecks in terms of those vaccines making it to your facilities?
It's about what we've anticipated, but it's the numbers fluctuate. You know, the federal release to the state release to the regional coalition release in our state, and then to us. So sometimes the numbers change, but we've been seeing, you know, at least a weekly allocation every week. And we anticipate, as the state does, they've done a great job, and we anticipate getting all of our healthcare workers immunized by the end of January. So we'll take it at this point.
Yeah. Dr. Gayle, I'm wondering what you're seeing in terms of the rollout in the Chicago area. Obviously, it's been very hard hit this year, like so many other cities, due to this pandemic. What are you seeing, and how, I guess, are you working with the different institutions and entities to ensure that there's, I guess, equitable distribution to those that need it the most?
Right. Well, and thank you. You know, I think, as the doctor said, you know, for healthcare workers, it's actually rolling out relatively well. You know, healthcare workers are highly motivated for the most part to take the vaccine. The vaccines that are available can be done effectively in a healthcare system. I think what we're most concerned about is the broader rollout and the rollout to the public. And I think it's going to be incredibly important that we have a national response and really think about what needs to happen from a national perspective so that states aren't left alone to make decisions. We want to make sure that there's adequate resources because, as we know, there's been a lot of money spent on developing these vaccines, but there hasn't yet been the kind of dollars made available for the distribution. And, you know, we often think about the cost of the vaccine, but there's also the cost that states and localities bear for the administration of the vaccine. And so we need to make sure that all of those different pieces of rolling this out are well resourced so that we can get as many people vaccinated as soon as possible.
Well, Dr. Gayle, what are you hearing on that front? I mean, I can understand how within a hospital environment it would be fairly straightforward to make sure the frontline employees get the vaccine. But what about, you know, seniors when they want to go to CVS or Walgreens? We're getting reports out of Florida that people have been sleeping out overnight to try to get the vaccine. Seniors I'm talking about. Are you getting any guidance on that front?
Well, I think that's where some of the challenges will be because each state is doing it a little bit differently. And I think we badly need a national blueprint so that this can be rolled out in an equitable way across the states. And so we are hearing stories, as you mentioned, of places where people are lined up, where it isn't yet orderly and really well delineated. Some states are making decisions about prioritizing elderly but not essential workers who are putting themselves at risk daily because of the jobs they do. So I think there needs to be, a more national approach to this so that there's some uniformity and that we can assure that there's equity in the distribution of this vaccine so that those who need it most get it, and the populations that have been most hard hit by this also are prioritized and have access early on.
Shepard Smith here. Thanks for watching CNBC on YouTube.